Welcome back. Your submission dossier is where years of development come together into one regulatory story. In this episode, we'll look at the main dossier types, what strong submissions have in common, and how to avoid the issues that slow review. For drugs, the pathway usually starts with the IND. That's the submission that supports opening clinical trials and shows the product can be studied in humans with an appropriate plan and supporting data. As development advances, the dossier expands into an NDA for a new drug or a BLA for a biologic. Both support marketing approval, but biologics place even greater weight on process control, characterization, and manufacturing consistency. For devices, the route depends on risk and novelty. A 510K shows substantial equivalence to a predicate, a PMA supports higher-risk devices with comprehensive evidence, and a de novo pathway creates a route for novel devices without predicates. The supporting structure matters too. Many device teams work from the IMDRF table of contents, and for FDA submissions, eSTAR has become a key format for preparing and sending information in the expected way. For global drug submissions, the Common Technical Document gives teams a shared structure with 5 modules. It creates a common backbone for organizing quality, non-clinical, and clinical information. Information referenced in multiple sections must be identical. Inconsistencies between clinical overview, integrated summaries, and individual study reports raise concerns about data quality. Harmonized content does not mean identical submission rules. Each agency has specific electronic submission standards, ECTD for FDA and EMA, ECTD for China. Format errors can delay review acceptance. At the same time, many regions are transitioning toward ECTD version 4.0. Teams need dossier strategies that meet today's standards while preparing for what's next. Problems usually start when assembly is left too late. Then teams rely on copy and paste, quality control gets rushed, and agency-specific requirements get missed right when precision matters most. Before a dossier ever reaches substantive review, it may face an acceptance or filing checkpoint. For devices, that can mean FDA refused to accept screening for a 510K. For drugs and biologics, it can mean filing review for an NDA or BLA. A well-organized, complete, and consistent dossier becomes your company's best advocate in review. In the next episode, we'll look at global regulators and what their differences mean for submission strategy. If you'd like to see how Regara supports dossier management, visit regara.ai to learn more.